Hello, everybody. This is Brian Devine from Topline, and today I'm very happy to have with me Dr. Hillis from Naples Natural Medicine and Diagnostics. Now, Dr. Hillis is a chiropractor in Naples, and he has a very unique practice. So, Dr. Hillis, let's kind of get started by having you tell us a little bit about what makes your practice different.
Sure, Brian. Thank you for having me. My practice is different because it's extremely comprehensive in its approach to individuals' healthcare problems. Chiropractic was based upon the integrity of the nervous system and removing interference from the nervous system. And over the years, the marketplace has run it very much into more neck and back pain applications, whereas there's a whole lot more to it. We know that our nerves go to every organ in our body, and so I'm trained to be able to detect where there's been an upset reported to the brain through the nerves by an organ in the body, and that gives me an extra advantage in my diagnostic workup, where I will do a very comprehensive history on a person, really sit and listen to their story, find out the origins of their problems. We will often send them home with very comprehensive metabolic questionnaires, female hormone questionnaires, neurotransmitter questionnaires, to find out more about their chemistry and how it's impacting their health. We do laboratory work on many of our patients, and it's usually rather comprehensive. They've usually had work done elsewhere, and so they need a second or third look at what's been going on with them. And so it's a very comprehensive approach to health problems that haven't been solved yet.
Okay, so we're talking about really whole health here, and you mentioned lab workups. Can you tell me a little bit more about that? And I know in the past we've talked a little bit about female hormone balancing. Kind of walk me through how that all ties together.
Sure. In traditional medicine, one wants to posit that there's a certain disease, and then you run the very specific test just for that disease.
Right.
In a functional medicine approach like I do, we cast a wide net over the individual to look for what possibilities that may not be the most obvious upfront possibilities may be affecting that individual. And that usually means a certain amount of comprehensive laboratory work that's typical in functional medicine, and it's something I've been doing for over 30 years. And I've thoroughly enjoyed this kind of work. It involves a lot of detective work in many cases where people have been to numerous other doctors, and they're looking to finally get some help with their problem. We do a fair amount of female hormone assessments, and this is for the woman who is in their childbearing years and who may be having distress with their periods and extreme cramping or bleeding. We may be working with an individual who's going through their menopause with great distress. And while there are some aids for all of these kinds of problems, there comes a point where people are looking for a better solution, a more comprehensive way of being helped. And I'm thankful that the word is out and that we're able to help a lot of these women with giving them the kind of workup that they deserve to get the relief that they need.
Oh, that's amazing. I mean, to know that there's a place for people to go where they can really get that not just going to a chiropractor for basics, but really the whole body and really looking at everything. And I think that's not only fascinating, but it's admirable. So thank you so much for doing that. You know, I think it's a good place for us to kind of wrap up. I really appreciate you taking some time to walk us through what makes you a little bit different and how you like to do things in your practice and how you can help people, especially women that are in that childbearing years. So for those of you that have caught us today and are watching this hangout, give Dr. Hillis a call. It's 239-597-3929, and find out if this is going to be just the perfect place for you to go and really get everything turned around for yourself. Dr. Hillis, thanks again for taking the time with us today.
Thank you, Brian.
Absolutely. Bye for now, everybody.